Welcome to www.new_york.healthsourcechiro.com/city/Comac. Today's topic, injuries hurt. Find relief through chiropractic. We've all sustained injuries at one point in our lives. Sometimes they're severe, tragic, expensive, and take years of physical and emotional therapy to recover from. Hopefully those injuries are more along the lines of falling down the stairs trying to avoid the dog and not being able to sit down without one of those inflatable donuts for a month. That is painful, but funny when told later. Or possibly funny to those not actually involved. Either way, we've all been hurt, and it adds up. Depending on your life and luck, some people have broken multiple bones. Others had never broken a one. However, you were doing your childhood wrong if you didn't fall out of a tree at least once, especially while trying to escape from a yard you weren't supposed to be in the first place. Generally, the bumps and bruises and breaks and sprains don't tend to seem like a lot at the time. Sure, they hurt, and sometimes there's even gushing blood, especially as no one ever takes regular blood seriously. It must be gushing. But as a rule, we heal up, use the scars to fill lulls in conversation, and move on. Until we start waking up in the morning and having trouble getting out of bed. It's daunting to realize that hamstring you pulled hiking 20 years ago is suddenly coming back to haunt you. As is the time you punched the wall, and the time, well, you know what I'm saying. The first instinct for most of us at times like this is to reach for the medicine cabinet. That's fine in the short term. We have to get to work, and even if we didn't, the shower is eventually going to get cold. In the long term, though, all that will do is foster a dependence on the pain medicine. That dependence is bad for a number of reasons. Narcotics are addictive on their own, and finding yourself on the street at 3 a.m. trying to sell your briefcase is probably not the first sign of a problem. Even the non-narcotic or non-prescription drugs can lead to problems. Ibuprofen, naproxen, sodium, and aspirin can do nasty things to your stomach. Painful knees or a bleeding ulcer isn't a good choice to have to make. Acetaminophen and many other painkillers are hard on your liver. Not that any of the above are bad in small doses or taken sporadically, but while they may deal with the immediate inflammation and get you moving again, they do not actually work to remove the pain. Not to mention the issue of having to take more and more if you use them too often. Or the lesser-known problem of your body starting to think it needs to hurt. What can you do other than take pills? Lots of things. There are stretching and strengthening exercises that will help the muscles cope and compensate. There are other exercises that can be done to stop you from putting pressure on injured areas. There are also chiropractic treatments that will alleviate the pain and reduce the symptoms and are often covered by your insurance. For more information on topics like this, go to www.new_york.healthsourcechiro.com/city/Comac.